As I said last week, stable is good, but decreasing is better. And while we are seeing stabilization of our numbers, that doesn't mean we can let up. We know this stability is fragile, and these trends can change quickly if we let down our guards. You only have to look at hospitals in other states that have been overwhelmed when reopening occurred too fast. In North Carolina, we've used the dimmer switch approach to easing restrictions. This ensured that we did not open too much, too quickly, which health experts say can lead to a devastating increase in cases, sickness, and death. In addition, it can lead to having to go backward, like some other states have had to do. There are key openings already occurring this month, as Dr. Cohen said. August means back to school time for our K through 12 students, as well as our colleges and universities. But it's not business as usual this year for our schools. Most of our students will begin school using remote learning, but others will have some in-person instruction. However, there will be fewer children in the classroom at one time, mandatory mask wearing, and social distancing. A number of private schools are starting back with in-person instruction as well. And our college campuses will have students, but they'll be using more buildings and less in-person instruction because of the pandemic. The opening of schools and colleges is an important one. Education must go on, even in a pandemic. In-person learning has benefits, but it means challenges for our state, especially as our higher education campuses draw students from around the country and the world. With the hustle and bustle of opening schools, people will move around more, and so will the virus. Other states that lifted restrictions quickly have had to go backward as their hospital capacity ran dangerously low and their cases jumped higher. We will not make that mistake in North Carolina. In keeping with our dimmer switch approach with school openings, and in order to push for decreasing numbers, which will keep people healthier and boost our economy, North Carolina will remain paused in Safer at Home Phase 2 for 5 weeks. Experts believe our mandatory mask order stabilized our numbers. And just last week, we added a curfew on alcohol sales to keep restaurants from turning into bars, which are high transmission areas. Our success at returning thousands of students, teachers, and staff safely to classrooms this month depends on us doing what works.